Kicks off now with Representative Sam Creekmore. He's a member, of course, of the Mississippi House of Representatives. Represents a District 14, which includes a Union County. Serves as chairman of Public Health and Human Services Committee. Representative Creekmore, always good to see you, sir. Thanks for coming on.
Always good to see you, Gerard. Thank you for having me.
You bet. Wait, what happened there?
Oh, my goodness. That's good.
Yes, indeed. It is the representative's birthday today. Happy birthday, Sam.
Thank y'all so much.
Yeah, man. Oh, pretty cool. Yes, we will admit we orchestrated all that earlier this morning.
Oh, me.
Good to have you, though. Appreciate you coming on here. So, how about this courthouse? You know, that is a very recognizable courthouse, a symbol, I think, of small town Mississippi, is it not? The Union County courthouse.
And stability.
Yes,
it's
good
just
point. Yes.
For downtown, and you know, well, unfortunately, we had a tornado come through and mess up the roof area, and that's why you see the new copper up there. Yeah. So
it's beautiful. It's copper. I said it was brass, but it's copper.
Yeah, and so that's being done now. And then also in the coming months, we've got plans for a new plaza, Veterans Plaza out front that will really enhance the courthouse and the whole square. Okay. So it's going to be a lot going on there.
Very cool. And we were just talking to Billie Jean Stroud, the director, of course, of community development in Main Street here in New Albany. And I observed, as I always do when I drive through many of these towns when we host remotes across the great state of Mississippi, that I try to pay attention to the shops, the storefronts, are they occupied? And certainly here in New Albany, she says 100% occupancy.
100% has been that way since y'all been coming up here.
That's awesome. And, that is amazing and an indication of a thriving community where people want to live and work and raise their families.
New Albany is really founded on connection and connectivity. And we've tried to enhance that. You see the new sidewalks going in, and walkability is a real important part, especially if you're going to be a retirement community. Yeah. But if you go back in the history of New Albany, the Tallahatchie River runs right through downtown, and the Chickasaw Indians, that was their trade route. And so when DeSoto came up, he helped kind of establish and met the Chickasaws. And we claim in New Albany that this is where the first barbecue ever took place in Mississippi. DeSoto brought the pigs to America. The Indians had fire. They broke bread together and cooked barbecue.
I love it. All right, so we were talking offline here a minute ago about how it seems like the sessions are just kind of running together here between the 25 and the 26th session. You guys, even though you're technically not convened, not in regular session, a lot of work's been going on outside of the sessions, especially with the Speaker in the House putting together these select committees. They've been meeting quite a bit.
Yes, sir. And of course, since Speaker White got into the Speaker role, we've done that. Last year, of course, I chaired with Hank Zuber the CON's select committee. And this year, the Speaker's been very aggressive on the school choice, and that select committee's been very busy. And public health, we've been very busy as well. We don't have a select committee, but we're hosting hearings. And we talked about the Ibogaine initiative. But another issue we have in the state is infant mortality and the lack of physicians as well in the rural areas, especially. So we're hosting a hearing on infant mortality, which it won't be a pleasant hearing at all, but we need to have that conversation in the state. So we'll be having that coming up soon. And then we're having some just meetings on how we can get physicians in some of these rural areas. For instance, in the Delta, there are 3 oncologists. The youngest is 61. Wow. And so in Mississippi, our people with cancer, the mortality rate's 23% higher than anywhere else in the country. So that's a subject that we're studying with the cancer task force, not a select committee, but a task force. So we're looking into that. We're also looking into first responders, suicide prevention and PTSD, and how we can get them the help. And we've discussed mental issues here, but they're the first ones on the scenes, the trauma they see, and they do have to go home to their families and live in society. So we're trying to figure out ways to get them the help they need. That's another task force.
Yeah.
So it's been a very busy out of session for many, especially in the House, but many legislators.
Well, I think any time you talk about health, you've always got to distinguish, do you not, Representative Creekmore, between the delivery of health care services and the health of our population in Mississippi, and those are both significant challenges for you guys.
Absolutely, and we recognize that many of our issues in the state are preventable, and so we're looking at how we can address that, especially with the younger generation, go and give them the tools and the information, the education they need to prevent further health issues as they get older.
Sure.
So we're looking at that. I've actually got a nutrition bill that will apply to the schools that we're vetting right now with the Department of Education, Department of Health, and several other interested parties. So that we're actually looking at that now.
Yeah, so certainly the distribution and the availability, you were just talking about the Delta where the youngest oncologist in the area is 61, which means they're likely approaching retirement,
right.
And it could leave a hole there. I know that OB gynecological service is also in short supply, especially in that region, right?
It is. And so we're looking at ways to incentivize physicians to go to these rural areas.
Okay.
And we've got a rural physicians program in the state right now, and that's helping us, but we need more, much more.
Okay, so you guys are talking about what can we do to recruit into the area or even better, retain those that are graduating from our medical schools.
Absolutely.
And keep them here to set up their practices.
Yes, sir. We had a meeting Monday with Department of Health, Dr. Edney, and on that very topic, and had several conversations.
Okay. So thinking about federal legislation, Representative Creekmore, of course, the One Big Beautiful Bill Act signed into law by the President a couple of months ago has got some key provisions in it that relate to health care. One of those, of course, is Medicaid. That's where there's probably as much involvement in the federal government in the delivery of health care services as there is in any program. It doesn't affect us too much because we did not expand Medicaid, most of those provisions with work requirements and verifying eligibility multiple times, twice a year, I think, and then the provider tax situation. It doesn't really affect us too much. Well, what are you guys watching where it might affect us?
Well, we're looking down the road, and you're right. We're still pretty much made whole through probably 2030. But then the money will start dropping as the bill stands right now.
Yeah.
And so I plan on, again, another task force, authoring a bill that creates a task force where we can really dig into this and what comes in 2030, how we can offset some of the funds that would not be coming from the federal government at that point. And because we have some hospitals that in the rural areas that, the margin is really, really thin, and this can really affect them. And it's so important to keep these hospitals open. And I prefer the beds to be empty because everybody's healthy, but, especially in these rural areas, they're important to the health and quality of life for those areas, in every area. We're fortunate, very fortunate here in New Albany. We've got a top 100 rural hospital in the country.
Yeah.
And when I became chair of public health, I've reached out to them and said, will y'all help me study these bills and how it affects y'all and every other hospital? And they've been, Ann Bishop's the CEO, she's been really good and helping me with bills. It's a team effort, and that's the way I look at it, not just in the legislature, but when I come back to New Albany and District 14, I'm a landscape architect by trade. I need these experts to help me analyze and tell me what's good and bad and what needs to be changed. So we're very fortunate to have a strong medical community here and such a strong hospital that stays engaged and helps me.
Yeah, we're up against the break. You can hang around for another second. Okay, we got Representative Sam Creekmore. So what I want to think about in the next segment is I know serving as chairman of public health in the House, healthcare being such a huge industry, something that affects every single Mississippian. I know you hear a lot from these folks in the hospitals and the medical community, and they're telling you kind of what they want you to work on in the legislature. Maybe we can touch on that in the next segment.
Okay.
Yeah, we got Representative Sam Creekmore. He represents right where we are, Union County. We're in New Albany, Mississippi, just across the street from the Union County Courthouse, a beautiful courthouse. We're here for the Tallahatchie River Festival, coming right back with Representative Creekmore. Welcome back, everyone. It's Middays from New Albany, Mississippi, Union County. It's the Tallahatchie River Festival that we're talking about today, but right now we're visiting with Representative Sam Creekmore, who chairs the Public Health and Human Services Committee. So, Representative Creekmore, before we went to break, I know health care is something that's pervasive, of course, in our state, and there are lots of policy around that. What are you hearing from health care professionals, hospitals, et cetera? What do they need from you guys?
They need employees.
Yeah.
I mean, and you hear that in every sector, really, in the state.
Yep.
But when you have beds that are available, but you can't put sick people in them because you don't have a workforce, and that's a real issue. And we touched on it earlier, but that, the rural physicians program, we're going to really look at that. But that applies to dentists too, nurses, and we have those programs in place. But we're going to look at how we can maybe do more with that as well.
So one of the things that those wily congressmen and women up in Washington are dealing with right now is a possible government shutdown, and the bone of contention, as you know, is the Affordable Care Act. It's health care.
Right.
And specifically extending or not to extend the enhanced subsidies that provide federal assistance to pay for premiums for coverage purchased in the ACA exchanges. Last I checked, Representative Creekmore, a little over 70,000 Mississippians are now obtaining their coverage in the exchanges. It's estimated that as many as 20,000 would just drop their coverage because of these enhanced subsidies going away. Is it scheduled to do so right now? Right.
That's a real issue in our state. With the coverage we got now, we got so much uncompensated care that the hospitals have to take care of, and with more of them losing their insurance, that's going to be a real issue, and that's another one of the things we're going to be looking at this upcoming session as a result that the big beautiful bill is looking how can we do it. And then you and I have had these conversations numerous times because the hospitals cannot turn them away, and I don't think they should be able to, but we also need to be able to get them the money they need to take care of.
I know a lot of people will say, and you've heard it too, well, they just need to kind of re-engineer, restructure, reorganize, their operation, but there's just so much you can do. You can't. There's no substitute for free. I mean,
that's right.
That's what's happening. Like, I don't know that there's any business out there to say, well, we're going to accommodate a certain amount of free product and service in our business model. Nobody builds a business model around that, but hospitals have to.
They have to. But in business, it's constantly changing, just like in healthcare.
Sure.
And so that's why we meet every year in the legislature. Let's continue to retool, remodel, revisit, analyze, and see what we can do to change with this ever-changing environment in healthcare and everything else. So we will continue to look at it.
There have been significant efforts, as you're well aware, in the past to either fully repeal or at least partially repeal the Certificate of Need, the so-called CON laws that exist in the state of Mississippi, as they do in many other states as well. We seem to get close, but never across the finish line. What do you expect this year?
Well, that's some unfinished business that we had from last session, and I really intend to bring that up early on in the session and at least pass what we got through last year, which was double the capital expenditures and create the Department of Health to look at things like dialysis and removing that from CON. So we'll Senator Bryan and I, we've agreed to kind of at least push that one through early on. But the original House bill that we authored did a whole lot more than that, and I would like to continue. Now, I've asked the Department of Health, and they would know better than anybody because they approved the CONs.
That's right. They administer the program.
Give me the services that need to be removed from CON, and I'll put that in the bill.
Okay.
And so they've taken that on, and hopefully by December 1st they'll have their recommendations to me and Senator Bryan, and we'll go from there. So that's unfinished business that we have, and I plan on bringing that. That's a priority for me, and I do believe that will allow these hospitals to work more efficiently.
Okay.
And that's one of the things we can do.
Sure.
With their federal income going to be cut short.
Yeah.
So that's we need to do that. Another thing I'm looking at is health information exchange and getting all our clinics, hospitals, CMHCs all on the same platform. And that way, information, you're here in New Albany, you get sick, you go to the hospital, your information from your hospital in Madison can be instantaneously delivered to this hospital, and have the whole state on the same system where they can all communicate. And then another thing that's not unfinished business but is continuing is the Opioid Council and the opioid settlement money. The 70%, which I think right now is $104 million, somewhere in there. There's money coming in each week, but that council's opened up a grant application that closed on September 19th, and now we'll be looking at those applications, grading those, and the intent is to get the money out to these people as soon as possible so that the opioid abatement can continue in the state. And then we have 15% that goes to the cities and counties, and it's come to my attention that there's some significant money. Like Lee County's getting almost $1 million, Tupelo's getting almost $1 million, New Albany's getting, I think, $130,000, Union County's getting $313,000. And these cities and counties, a lot of them there's no guidelines for that money. So they could actually spend it on the sidewalks, but that's not what the intent of the money was.
Okay.
So I'm considering authoring some guidelines to help these cities and counties use that money for opioid abatement. And so and that will continue on, Gerard, to 2040. That money will continue into our state. And as you know, 500 Mississippians die each year from opioid overdose, and it's just a real serious issue.
Huge problem in the entire country, and the president at least is focusing on it to some degree. I mean, he recognizes this is a problem that we need to address, and it's right here at home in Mississippi as well.
Yeah, and and I'm glad he's focusing on that because the more we can have these conversations, the more we can get rid of the stigma, just like in mental health. Yeah. Let's have these conversations. And everywhere, I was in Tupelo speaking at a mental health conference yesterday, and then a mother comes up and says, thank you for this, and let's have this conversation. I have a son that, and it was on the Ibogaine. I said, I would send him to Mexico right now to get this Ibogaine treatment. I said, well, continue to do the research, but it's a real issue.
We've been talking about health care. Of course, that's the committee you chair, but the speaker has, of course, announced that education freedom, school choice is the top priority for the 26th session, having, I think, a meeting tomorrow, if I'm not mistaken.
That is correct.
So where do you stand on that, Representative Creekmore?
Well, I'm for the school choice. Okay. I am. And the speaker and I have had conversations. Rob Robertson, who chairs education, I talked to him yesterday. I mean, we have incredible schools here in Union County. They're all A schools. Both of them, school systems are in the top 10 in the state. And I make the argument that we really already have school choice here. The school systems have, if a child wants to go from New Albany to Myrtle, New Albany has to release the child, and they can go. And so in the bill we did last year from the House, we just removed that one step where schools had to release. And so we do have kids going from one school to another here in Union County, and they're both, but the schools are thriving. New Albany may offer something that a county school doesn't have, so let that child come.
Makes sense.
And so they all get along well, and we're doing it. But the speaker, and I'm anxious to see what the final product will look like. The federal, Trump and his staff are pushing universal school choice. We cannot afford that here in Mississippi, but I think we can have some form of school choice, and where that money does fall around that we can't afford, and then work toward universal school choice. I'm for it. I'm with the speaker.
Okay. I think Representative Owen, he was on a couple of weeks ago. Of course, he authored the just public-to-public transfer bill last year. I think he's going to bring that out again and maybe add some nuances to that. The problem is, is we can't get it through the Senate.
I know. Well, I'm hoping through all these hearings and now that the House has made this a priority, that, and I know Rob is working with Dennis DeBar and they
Senate
communicate.
side, yeah.
And let's just have these conversations outside of session and try to come with something we agree on. You know, we get along well with each other outside of session, but sometimes when they get on their end of the hall, we get on our end of the hall. There seems to be a big chasm in the middle, but we can get it worked out.
Maybe it'll be different this year. We'll get something through.
You know, and with it being a priority for President Trump, it kind of helps.
Yeah.
Especially in the Republican Party.
Absolutely. Yep. Well, Representative Sam Creekmore has been our guest here in his home area here in Union County. That's the district incorporated in District 14, which he represents. He serves as Public Health and Human Services Committee Chairman. Always good to see you, and happy birthday, Representative Sam Creekmore.
Thank you so much.
Coming on, man.
Yes, sir.
Appreciate it, buddy.